We did our presentation on the social determinants of health, and the social determinants of health are the non-medical factors that influence an individual's health outcomes, including economic stability, education, healthcare access, neighborhood conditions, and social relationships. These determinants shape overall well-being by affecting opportunities for healthy living, access to resources, and exposure to risks. For example, individuals with stable income, safe housing, and quality education are more likely to experience better health, while those facing poverty, discrimination, or limited healthcare access may suffer from worse health outcomes. Addressing these social determinants is essential for reducing health disparities and promoting equity, ensuring that all individuals have the opportunity to achieve optimal health. Social determinants of health significantly impact people with disabilities, often creating additional barriers to well-being. Economic stability is a major challenge as individuals with disabilities may face higher unemployment rates, lower wages, and increased healthcare costs, leading to financial strain. Healthcare access and quality can also be limited due to physical, financial, or systemic barriers, resulting in delayed treatment and unmet medical needs. Education opportunities may be restricted by inadequate accommodations, affecting employment prospects and long-term economic security. Social and community support is crucial, yet people with disabilities often experience social isolation, discrimination, and reduced participation in community activities. Neighborhood and built environments play a role as well, with inaccessible housing, transportation, and public spaces limiting independence. Addressing these determinants is essential for improving the quality of life and health outcomes for individuals with disabilities. However, with extra assistance, those with disabilities are able to thrive in all of the aspects of the social determinants of health. Health and healthcare refers to a person's access to quality medical services and their ability to maintain overall well-being. This includes factors such as the availability of healthcare facilities, affordability of services, health insurance coverage, and health literacy. People who face barriers to healthcare, such as high costs, geographic inaccessibility, or systemic discrimination, are more likely to experience worse health outcomes due to delayed diagnoses and inadequate treatment. Limited access to healthcare can lead to delayed diagnoses, poor treatment of conditions, and ultimately poor health outcomes. Some of the influencing factors of access to health and healthcare include socioeconomic status, insurance coverage, and language barriers. Preventative care, timely medical interventions, and access to specialized services are essential for maintaining good health, yet disparities in healthcare access contribute to inequities in overall well-being. Addressing these issues through policies that improve healthcare affordability, accessibility, and education is crucial for promoting health equity and reducing health disparities.
So the social and community context for individuals with disabilities plays a significant role in shaping their overall health and well-being. These contexts include their interpersonal relationships, so their family, their friends, coworkers, and community engagement, so if they are participating in clubs or organizations, social inclusion, and access to social support networks. A strong support network improves mental health, increasing access to health, and lack of social support can lead to isolation and stress, as well as worsened health outcomes. Inclusive communities that offer accessible infrastructure, public spaces, and social services promote participation and independence. The individuals with disabilities often face discrimination in healthcare, employment, and social interactions, so it's important for us to be aware. And that stigma can lead to negative self-perception, reduced access to sources, and reluctance to seek necessary medical care.
The environment domain of social determinants of health has a major impact on communication, cognitive linguistic development, and overall health outcomes. For SLPs and PAs, recognizing the environmental factors influence patients is essential for delivering equitable, high-quality care and reducing health disparities. So having a neighborhood and built environment requires access to nutrition. For SLPs, malnutrition and food security can impact speech and language development, particularly in young children. Poor nutrition during critical development periods is linked to delayed language acquisition and cognitive deficit. For PA, access to foods increases the risk of obesity, diabetes, and cardiovascular, which can exacerbate like indica. Quality of housing and indoor environmental hazards for SLPs. Poor housing conditions can to neurodevelopmental disorders, cognitive delays, and speech and language impairments in children. And for PAs, exposure to allergens, toxins may increase respiratory conditions such as asthma, which can affect vocal health and overall communication abilities. Environmental conditions such as pollution, noise, and green spaces. For SLPs, high noise pollution can negatively impact language processing and auditory comprehension, particularly in children with hearing loss or auditory. And for PAs, air pollution and toxins increase the prevalence of neurological conditions such as Parkinson's and dementia, impacting communication, swallowing, and overall quality of life. Crime, violence, and psychological stress. SLPs, children can be exposed to chronic stress and trauma and may experience SLP delays, selective mutism, or social communication deficits. Adverse childhood experiences have long-term impacts on language and literacy development. And for PAs, chronic stress from unsafe neighborhoods is linked to increased risk of hypertension, mental health disorders, developmental delays, which all impact overall patient care. And lastly, transportation and access to healthcare services. For SLPs, limited access to transportation may prevent children and adults from attending speech therapy sessions, leading to gaps in intervention and processes. And for PAs, patients in underserved areas may delay seeking medical care, leading to worsening health conditions. For example, untreated strokes and unaddressed hearing loss. Telehealth and mobile clinics can bridge this gap.
An individual's education and health outcomes are directly linked. According to the Office of Disease Prevention and Health Promotion, children from low-income families, children with disabilities, and children who routinely experience forms of social discrimination, like bullying, are more likely to struggle with math and reading in school. They're also less likely to graduate from high school or go to college. And then this can lead to less likely to get safe, high-paying jobs and more likely to have health problems like heart disease, diabetes, and depression. And economic stability and health also go hand in hand. This includes things like income and healthcare access. So individuals that have higher incomes are more likely to afford health insurance, quality medical care, and healthier food. Housing and living conditions. So economic stability allows people to live in safer neighborhoods with clean air and better healthcare facilities. And stress and mental health also go hand in hand. Financial instability is linked to chronic stress, anxiety, and depression, which can contribute to long-term health problems like hypertension and cardiovascular disease.
So here we have the different medical or the comparison models of disabilities. So first there's the medical model, and from the medical model's viewpoint, disability is seen as a defect or abnormality. The social model is when there's disability is seen as a difference or diversity, and the biopsychosocial model is when disability is seen as interaction between three sets of factors, which is physical, psychological, and social or environmental factors.
So our first additional question is, what would you consider the main reason for a shorter life expectancy of individuals with IDD? Delayed or inadequate health care, chronic health conditions, mental health and behavioral challenges, increased risk of respiratory and swallowing issues, and medication complications, and institution and residential care risks. For healthcare, individuals with IDD often experience barriers to healthcare, including a lack of providers trained in their needs, communication challenges, and difficulty navigating the healthcare system. For health conditions, higher rates of anxiety, depression, and behavioral disorders are common in individuals with IDD, yet mental health services remain limited or inaccessible, and suicide risk is elevated among individuals with co-occurring IDD and mental health conditions. For mental health and behavior, they have a higher prevalence of dysphagia, increasing the risk of aspiration and pneumonia, which is a leading cause of death, and respiratory issues, often due to weakened muscle tone, and Down syndrome or cerebral palsy, contribute to chronic lung infections and complications. Many individuals with IDD also face poverty, poor housing conditions, and food insecurity, which can impact their overall health. The use of multiple medications is common, increasing the risk of adverse drug interactions, sedation, and side effects that impact long-term health. And institutionally, they may experience neglect, inconsistent medical care, or higher exposure to infectious diseases. And a lack of properly trained staff in IDD care can lead to poor management of chronic conditions. Our second additional question is, how could you approach a healthcare provider and your team if you believe they're ignoring the social determinant of health in a patient's case? So the order I would do it would be appropriately choose a time and setting. Be sure to address concerns in private or in a group huddle where everybody can listen. Make sure not to go at it in an aggressive way. Collaboration from the discussion as a shared goal to improve patient care rather than a criticism, and use I statements to avoid sounding accusatory. Focusing on the patient's needs, bringing concrete examples of how it's affecting the patient's condition. Offer solutions by providing resources or referrals that can address the barriers, and reinstate team-based care. Remind the provider that addressing the is a team effort and it doesn't fall solely on one person.
So in conclusion, the social determinants of health for individuals with disabilities impacts their health outcomes by influencing access to care, education, economic stability, and community support. It's important to address the determinants of health in healthcare to improve patient outcomes, reduce disparities, and promote equitable healthcare for all. We want to address the underlying factors that contribute to their health, and then we also want the health outcomes are not just determined by the individual's genetics or choices but instead by social and environmental factors that surrounds the individual. So we think that's important to know as well, because with extra time and resources, individuals with disabilities can excel and receive quality of care.